Good day. My name is Shay Patel, a second-year biomedical sciences student attending the University of Ottawa. I have had the pleasure of working with Dr. Nirupama Agarwal, a professor in disaster and emergency management at York University in Toronto, Canada. Together, we have developed a commentary pertaining to the basic reproduction number, R0, in the context of COVID-19. I am pleased to participate in this conference and share research with audiences around the world. I will introduce the topic with a background, followed by the purpose of the research, data, and discussion. I'll conclude the talk with some remarks. This is the global picture of the COVID-19 pandemic shown on the World Health Organization website. The darker regions have recorded more deaths. Cumulative deaths so far, as of last week, were over 5.2 million individuals. Here you see the total number of deaths caused by COVID-19 by regions, Americas being the highest, followed by Europe and Southeast Asia. In the past year and a half, a plethora of literature has been generated to advance our understanding and knowledge of coronaviruses and the diseases they are capable of causing. This short commentary is about understanding the reproductive number R0 in the context of SARS-CoV-2 virus and COVID-19, the disease it causes, spreading a pandemic that has brought the world to its knees. The basic reproduction number R0 is the average number of people onto whom one infected person will pass the virus, SARS-CoV-2 in this case. If R0 is above 1, the epidemic will grow exponentially, and the outbreak will dissipate if R0 is below 1. R0 is a dimensionless number and an indicator of the contagiousness of a pathogen. It is not a constant for the pathogen itself, but rather a constant for a pathogen in each population. SARS-CoV-2 would have a reproduction number of about 3 if no intervening action was taken to stop its spread. The World Health Organization initially, by November 2020, estimated R0 for COVID-19 to be between 1.4 and 2.4. For a perspective, measles has an R0 number of 15 in populations without immunity, meaning on average, one person will spread measles to 15 others. Further, the R0 value of the 1918 Spanish flu pandemic was estimated to be between 1.4 and 2.8, and the H1N1 virus outbreak in 2009 had an R0 value between 1.4 and 1.6. This is a stark reminder of the high R0 values in the beginning of COVID-19. There were over 3.5 in some countries, including Italy, and currently, India and Japan are treading just below 1. This indicates that in these countries, the spread of the virus can be assumed to be under control, at least for now. However, R0 values are still above 1 in Germany, the United States, and Canada, and even the UK. There are two main utilizations of R0: to assess the ability of an infectious disease to invade the community, and to determine the fraction of the community which should be vaccinated in order to prevent the proliferation of the disease. R0 is calculated with the assumption that the population has zero immunity through infection or intervention. R0 is a positive continuous variable in that it can take on any value within the interval 0 to infinity. Based on the observed value of this metric, different assumptions can be made for the societal prognosis of the disease. If R0 is less than 1, the number of cases will decline, and ultimately the disease will become eradicated. For every individual who currently has the disease, fewer than one person will become infected. An R0 value of 1 indicates a stagnant progression and can be thought of as an equilibrium state. Each infected person will infect one additional person. However, the conditions of the outbreak will not intensify. The range of values most worrisome for epidemiologists and health professionals is when R0 is greater than 1. For instance, an R0 value of 3 suggests that for every currently infected subject, 3 more will contract the disease in question. The basic reproduction number R naught is an epidemiological value that is used to assess the transmissibility of a disease. Irrespective of the model used to calculate this figure, several factors are of particular interest. R naught estimates are a function of the following factors: the duration of contagiousness of the infected person, the likelihood of infection to be passed on to another person based on the exposure, proximity, and susceptibility, compromised health, age, etc. of that person, and the contact rate. Kucharski's back-of-the-envelope approach for a quick assessment of R naught uses duration, opportunity, transmission probability, and susceptibility, the DOTS method, where duration is about how long someone is infectious, a week or two in the case of SARS-CoV-2 virus. The opportunity is a measure of how many people come into contact with you for every day you're infectious. Transmission probability is a measure of the chance the infection will get across during an interaction. Lastly, susceptibility measures the chance that the person at the other end of the interaction will pick up the infection and become infectious themselves. Multiplication of the DOTS variable numbers gives R naught. To analyze the spread of diseases such as SARS-CoV-2, compartmental models such as the susceptible, infectious, removed SIR model are used. Epidemiological studies that divide a population into compartments utilize differential equations for computations and analyses. This branch of mathematics focuses on the rate of change of a variable or group of variables as time passes. The SIR model divides subjects into three compartments: susceptible, infectious, and recovered. The terms recovered and removed are often used interchangeably in various literature sources. The proportion of susceptible individuals is highest at the start of an outbreak due to the vast numbers who have yet to be infected. The proportion of infected persons follows an inverse trend. It is initially low. However, as the disease transmissibility increases, it rises. This rise is sharp in the case of COVID-19. The term removed refers to individuals who no longer possess the pathogen in question. This encompasses both deceased and recovered subjects. The proportion of susceptible, infectious, and removed individuals must sum to 1, depicting a constant population size as time progresses. This is a stipulation to maximize the validity of this model. Time is an independent variable upon which factors such as susceptibility, infectivity, etc. are dependent. Countries around the world were using R naught for the prediction of daily and cumulative cases for COVID-19 infections, as well as the near future projections. So it's critical to understand and identify the potential differences and biases in data points, and raise questions about the accuracy and comparisons of R naught. The date of the data point used in calculating R naught has not been consistent across the board. Some of the differences include the date being the symptom's onset date or the date of the positive test result. Second, the use of contact tracing systems versus using assumptions or estimate. And third, excluding or including migrant cases among confirmed cases. Case in point, Kerala State in India in June of 2020, where migrant travelers were counted to predict infections for the following 2 months. The wide ranges in R naught values reported by different studies indicate that exact estimations of R naught are not so straightforward as the general perception. Mathematically, the herd immunity threshold can be very simply calculated as 1 minus 1 divided by R naught, where R naught is the basic reproduction number. Earlier in the pandemic, the SARS-CoV-2 R naught was 3.5. Based on this figure, the herd immunity threshold for COVID-19 would be 1 minus 1 divided by 3.5, or 0.71. Hence, the simplest calculation, 71% need to be 100% immune to push SARS-CoV-2 into decline. If you consider the recent Omicron's R naught value of 6, the corresponding herd immunity would be 1 minus 1 divided by 6, or 83%, which is a very high percentage of the population that needs to be entirely immune by vaccination or having recovered from COVID, and therefore challenging. In addition, in low-income countries where vaccine availability is low, the virus can easily mutate, making it even more challenging to control the spread of the disease. However, key inputs keep changing. This graph shows the Delta variant cases as 2-week rolling averages in the world as of November. This gives you a sense of the extent of its spread. Noteworthy countries are Singapore, Russia, and Cambodia, where 100% of the cases are of Delta variant. Here you see the Omicron cases that are clearly spreading in South Africa and slowly creeping up in other countries. Although in the United States and Spain, the numbers do not appear to be alarming. It is only a matter of time when Omicron will dominate most cases due to higher infectivity rate compared to Delta. If you look at the vaccine scenario in the world, as per the share of people vaccinated, UAE tops the chart, followed by Cuba and Portugal. On the lower end of the spectrum, the lowest vaccination rates can be seen in African countries, such as Tanzania, Nigeria, and Ethiopia. Lastly, here are the latest numbers of daily new cases of infection per million people for 6 countries. The UK and Germany leading the chart, with the United States and Italy in a somewhat better situation. Just imagine how challenging predicting the trend of the pandemic could be in order to develop effective control measures for the whole of society. The first and foremost in such infectious outbreaks is the universal approach to isolate the infected. Quarantine comes from the Italian quaranta, meaning 40, as in 40 days of isolation. The most effective way to do that is through mathematical modeling, with the caveat that a variety of models and methods are available for the purpose. Therefore, care must be taken about how R0 estimates are computed and for what purpose. Studies show evidence of scholarship and partnerships on providing guidance on prevention and control measures based on R0 data. In order to eradicate the current predicament, it is vital that R0 is kept below 1. This will lead to the eventual dissipation of the disease in question. If you have any further questions, the emails of my professor and I are detailed on this slide. Thank you very much for this wonderful opportunity. Have an amazing rest of your day.